Hello, friends. It is March 16th, 2020. Nick Vargas here at The Source. Again, this week, and for the time we need to, we're going to be bringing a virtual LGBT center to you. And we still want to maintain ties. We still want to let you know that we're here. We're available if anybody needs to talk. And we want to educate, inform, and entertain. And for today, we have a very special guest with us. We have Dr. Tina Bhargava, Professor of Public Health from Kent State University in Ohio. She is joining us live, and it's really my pleasure to have her here. So Tina, how are you doing? Like, this is what you do. Tell us what is going on with public health. What's exciting to you right now? And then maybe we can talk about what measures we're seeing and why they may or may not be effective. So go ahead.
Great. Thanks, Nick, so much for asking me to be on the show. I'm happy to be able to be here. I miss California. Not the best time right now to travel, but hopefully I'll get out there maybe in a few months or so, maybe when it's winter here. That's usually the best time to come back and visit because I do miss you guys. So yeah, this is a public health time. This is public health. I talk to my students all the time. I teach undergraduates and graduate students about public health, and I talk to them about what is public health. And a lot of times people don't know this is public health. And public health is doing things to keep people healthy that they can't do for themselves. So there's lots of stuff people can do to keep themselves happy, eat better, exercise, and stuff like that. Public health is us doing the things that people can't do for themselves. And so when you're seeing these big policies and changes and restrictions, that is public health action. I'm excited because I'm in Ohio, and Ohio is doing an outstanding science-based job of leading their policies. So that is a super exciting thing for me to see that, as soon as we had confirmed cases in Ohio, our governor, asked all of the higher education institutions to shut down and moved to remote teaching. Within a couple of days, he had closed down all of the schools. Like, all the K-12 schools are closed until April 3rd. Last night, he put in a restriction on bars and restaurants are closed for seating. They'll only do carry out and delivery. So there have been a lot of really good choices that are made to try and reduce the spread and flatten the curve. I'm sure you've heard of the flattening the curve now. That's become a big thing, the flattening the curve of the coronavirus.
If you could, because I've heard a lot about it, I'm sure people have heard a lot about it, but if you could explain it again, I think it's important for people to hear. What is flattening the curve, and why is it important?
Okay, so flattening the curve is about spreading out how quickly people get the disease. What we don't want to see is a really big, everybody getting it at once. So I saw this meme on Facebook, and I don't recommend using Facebook as your information source, but it was a really good example. Was you know how people all went to the grocery stores to find toilet paper, and now nobody can find toilet paper?
Yeah.
Like that. So if everybody gets COVID-19 at the same time, everyone's going to be wanting the incubators or the ventilators, and there aren't going to be any, right? Just like there's not any toilet paper, we don't want to go hoard stuff. So right now it's kind of a good parallel to, like, what we don't want to do is use up all the healthcare resources all at once. And so we're trying to spread it out. So we still think a lot of people are going to get it. We think a lot of people have it right now and they're not aware of it. The idea of flattening the curve is to not spread it as quickly as possible. And we're so social. We have such a global society now that we tend to spend a lot of time with other people and interact with other people in a lot of ways that right now are just not advisable for trying to keep the spread of the virus down. Does that help a little bit?
Yeah, that helps. That's my understanding too. So Ohio was, in your opinion, really good about doing what they needed to from a public health policy of doing those things that people can't do for themselves.
Yeah.
Can you speak a little bit to what California is doing right now?
Yeah, so I don't know it all because I'm not there, so I'm not getting your guys' news feed or your local news or hearing all the announcements you do. I did look into it a little bit to see what they're doing, and it looks like they've started making some good precautions. My biggest concern for what California is doing is that it's not policy, it's not system-wide policy, right? Right now they're making guidance and recommendations the problem with doing guidance and recommendations instead of requirements is that it doesn't impact people equally, right? So it's the person who's making the choice who takes the responsibility. So when you say, as the governor of the state, I'm making this choice, then the governor takes the responsibility, and it's their job to make sure that the system works out okay. But if you say, I recommend you do that, then each individual or each school or whatever has to make that choice, and they take on the responsibility, and that's much more difficult burden. So what we're seeing now, I think I saw the latest numbers in California is 51% of the school districts were closing. Like, which school districts do we think aren't closing? Which school districts do you think are closing? Like, there's going to be a difference between them. And the schools that probably have fewer resources and less choice about how to do things are the ones who can't close. So what we end up doing is widening the gap. Like, the people who already have the resources and the advantages are able to have more resources and advantages. And the people who don't have the choice and aren't able to get the support from the system because the system is not making the decision. Does that make sense?
That makes sense. And it's probably different in Ohio, or I don't know, but one of the ways our schools are funded is by attendance. So
Yeah.
like you're saying, there's incentive for schools that already are feeling a crunch in resources to keep students enrolled, to keep people attending.
Yeah, and I get that there's really big impacts of making system-wide choices, like shutting down all the K-12 schools or restricting people from bars or restaurants except for carry out and delivery. I get that there's a really big impact. But if the government makes that decision, then they take on the responsibility of that impact in a way that's really different. So if you have restaurants that are making choices based on trying to keep their doors open, that's different than restaurants that are making choices because that's what they're being mandated to do. And when everybody has to make the same choice, you get more equality in the outcomes. And that's really what you're looking for public health, is health equity. We want everyone to have the same chance to be healthy. And this is not the kind of situation where you see that when you have these big natural disaster type things, right? We saw this with Hurricane Katrina, with the heat wave in Chicago, decades ago. Like, you see that the people who have the least number of choices, usually people who are lower income or communities of color, rural communities, those are the communities that really get disadvantaged because they just don't have the resources to be able to do the things that other people can do. I can self-isolate at home if I want. That's not a big deal for me. I'm a professor. I can teach remotely and teach from home. But there are a lot of people who don't have a choice. And if you don't put the policy in place and the mandate in place, they continue to not have a choice, right? So it sounds like we're giving people a choice. Like, you can decide whether you're going to close your restaurant or not, but is it really a choice? Like clearly the smart thing to do is to close. So if you're not, there's something else driving your choice, and it's not the best interest of the public health that's really going on there.
And in my opinion, what's driving that choice is people need money to survive in the world we live in, and they're afraid. Like, money is so important. A lot of small businesses, like my grandmother-in-law's bar, like, when she heard the news about possibly having to close down her bar, she was scared because they, like 3 weeks, that could affect their ability to survive. I've heard that, so I understand people wanting to and needing to stay open, but I feel like there's policies the government could start to implement to help out small businesses. Like, I started a hashtag, small business bailout, because I think if we're going to implement the public health policies from the top down in California, like we probably should, we have to look out for those people who are going to be economically affected.
Yeah, and I'm not an economist, and I'm not a political scientist, and I'm not an economist, right? So I can't speak to the specific what would be best. What I know is that in Ohio, because they've made this mandate that people have to close restaurants and bars, they're also putting in place that anybody gets laid off can immediately get unemployment insurance. And so when the state takes the responsibility for making the rule, then they also have to take the responsibility for how they're going to deal with the impact. And to me, that's why it's so important for the state to take that responsibility, so that they then also take on the responsibility for some of the economic impact. Does that mean that nobody's going to be negatively economically impacted? Absolutely not. I don't know how we can avoid that. I think right now, if we can really do the social distancing, and if the states can make some really good decisions about what kinds of policies and regulations need to be in place, we may be able to flatten the curve, slow this down, and not run into a situation where, like we're seeing in Italy and other places, doctors are having to make life or death decisions about who they put on a ventilator, right? So based on your life expectancy, based on your risk factors, do you get to live or not live? It's not the kind of decision making we'd like to see. And we have way fewer healthcare providers and way fewer healthcare resources than many other countries. So per person, we're in trouble if we get there. We really need to do the social distancing now is when it matters, to even these things out over the next few weeks.
Right. So, and you may not have an answer to this, but something we're trying to grapple with is, and when I look at it, the two scenarios. So one scenario, we've sort of gotten ahead of the virus, and we're going to flatten the curve, and that will go out for a certain amount of time. But the other, maybe we didn't do enough as soon as we should. And what are some of the things we can look to see if what we're doing here is working?
So that's a tricky part. So one thing is, I think it's going to be somewhat regional, right? So we're a country, but we have different policies going on, different weather conditions going on, different kinds of structures of school systems going on. There's all kinds of differences between our states. So I think we're going to see some regional differences and how effective this is being. The best thing that could happen is that we feel like we overreacted. So this is the part about public health that, again, I tell my students, public health is not very sexy. Like, we make things not happen, right? That's not really fun to tell people, like, I made something not happen. Like, okay. And then plus, how do you prove you made something not happen? Well, it didn't happen. So how do you know how it didn't happen? It's really difficult. But what we would like to see is for this not to take off and to feel like we overreacted. So when we feel like, okay, well, see, we didn't really have to close these things, then that's showing us that we really did need to close these things, because right now it's not even a hypothetical projection anymore. We are seeing it in other countries. We are seeing what the virus is doing. So it's not even like we're just predicting based on nothing. We have really clear examples of what's going on in different countries that are trying different strategies, and we'll see where our disease curve goes based on that. I think that the more cautious you can be, the more you should be. And I think for sure that those states should be taking the responsibility for the difficult decisions, and then helping their citizens as they struggle through what the impact is of those choices, because there is going to be big impact. I think what we want to avoid is having the impact in a way that it's out of our control. We're not making the decisions, which is what we're seeing in some other places right now. This is not the choices that people are making. This is what has to happen because they're in such a desperate position.
Right. No, I agree. Here at the Source, we have been taking new steps as they've come up. Today, where all the staff will start working from home, and we are still going to be messaging out, probably even more. But I'm glad to see that people around me are starting to take this really seriously. And I hope that we get 3 weeks from now, like, oh, we overreacted. Yeah. Knowing that we actually probably stopped the spread so that it can be manageable by the hospitals, and those healthcare providers don't need to make those life or death decisions.
Yeah.
That's, but it's just a difficult, weird time for everybody. And we want to let our constituents know that we're available. Even though we're not here, we're going to be available by messages, by email, we're going to have our phones. So people need to reach out and talk, or they just follow us for more information.
Yeah.
So, Tina, before we let you go, is there any other things you'd like to tell our audience here?
I think the biggest thing that I want to make sure is clear is this is a really challenging time. And I think we have to have a lot of compassion for the people around us and a lot of compassion for ourselves. And I think we need to think about what we need and how we're going to move through these times. There are people in all kinds of different situations that this is going to make very difficult. I'm thinking of like public health wise, people who are in recovery or people who are just starting to start with sobriety or deal with addiction. This is a really hard time when they generally are going to rely more closely on the people around them. And it feels harder when you can't see them in person. So I just want to remind people that we have all these amazing ways of communicating. We can set up conference calls. We can set up all kinds of things. I've been setting up conference calls with some of my friends for the last few days, and I just feel more human afterwards. Mm-hmm. I just feel like, okay, now I talked to I heard their voices. I know what they're going through. We all are able to share with each other how grateful we are for the things that we do have. And that just helps solidify us in moving forward. So taking care of your mental health, I think, is critical during this time. We have to hope that the people who are making our decisions are taking care of our physical health well. And at the same time, we need to also be taking care of our mental health and keeping an eye out for each other and understanding that just because we can't hug or say hello or get together doesn't mean that we can't. Like Zoom exactly is a great way to have a couple's dinner together. Like you guys, maybe me and Jason and you and Dean can get together and have dinner. Like you on your side and ours on our side, right? There's no reason we can't.
Yeah, it's so good to see you. And for people, I didn't announce this at the beginning, but Tina and I have been friends since college. We went to Stanford together. We're in the same sophomore dorm. So so it's just really good. Like this is an opportunity now to actually take some time and see your face, and it's so good. And so if other people can use this time too to reach out and check on people, I think that's part of the silver lining, the opportunity during this time.
Yeah, I agree.
So you mentioned sobriety, and that's a topic recovery, that's a topic that we care deeply about here at The Source. So meetings are life or death. Recovery, staying sober for some people it's a life or death. And right now we are messaging out.
Yeah.
And we know of meetings change, like our Rainbow AA meeting changed last week, and we messaged that out on our Facebook. There's also groups that are organizing online meetings, face-to-face meetings. So if somebody out there is in the recovery community and is looking for meetings or resources, message us on Facebook, send us an email, and we will do our best to let you know what we know about how to get in touch with people in the program so that you can, especially right now, be in contact with like-minded people who can support you. And so definitely watch our resources for that. And
if you do end up going to meet people individually or going to meetings because you feel like you really need that support, you have to make those judgment calls. But they're also, it's not like, oh, well, I'm going to do it, I might as well do whatever I want. Like, please use reasonable, cautions, like stay the 6 feet away from people. Don't be sharing coffee or other things just because that's what you normally do. It's time to shift and make sure you're really focusing on the important part of what you're getting out of those resources, the connection with other people, rather than just falling kind of into the routines, which are very comforting, but right now not what we need to be.
Yeah, maybe we don't need to be holding hands at the end of our.
No, that's probably not the best choice. Or making shared coffee. Those are probably also not the best choices. So adjust, right? Find some basic guidelines for how you can adjust. And again, like chat, text threads, conference calls, all kinds, Zoom conferences. These are all ways that we can also connect with each other in this time.
Yeah, we plan to be very connected with our audience, and it's good to see you. I will check in with you later this week, and yeah, maybe I can introduce you to Dean virtually.
Sounds good.
That would be good. But take care of yourself. Thank you for your time today.
You're welcome.
And, we'll be in touch.
Okay, sounds good.
Bye-bye.